Madam President.
Senator from Tennessee.
Thank you, Madam President. I ask consent to speak for up to 30 minutes.
Without objection.
Madam President, today I'm asking experts at the American Enterprise Institute and the Brookings Institution, as well as other leading healthcare experts, for specific ideas about how Congress and the President can work together to reduce the cost of healthcare in the United States. Here's why. Last July, at the Senate Health Committee's second in a series of 5 hearings on reducing healthcare costs, Dr. Brent James, a member of the National Academy of Medicine, testified that 30% and perhaps as much as 50% of all the money spent in this country on healthcare is unnecessary. That startled me, and I hope it startles you. So I asked another witness, Dr. David Lansky from the Pacific Business Group on Health, if he agreed with Dr. James' estimate that 50% of all the money spent on health care is unnecessary. Dr. Lansky said yes. And then at our next hearing on reducing health care costs, not one witness on our distinguished panel disagreed with Dr. James. That means we're spending as much as half of all we spend on health care on unnecessary treatment, tests, and administrative costs. As a country, we spend a huge amount on health care, $3.5 trillion in 2017, according to the Center for Medicare and Medicaid Services. So when we use Dr. James' estimates, that means we spend roughly $1 to $1.8 trillion on unnecessary health care in 2017. That is more money than the gross domestic product of every country in the world except 9. That is 3 times as much as the federal government spends on all of our national defense, 60 times as much as it spends on Pell Grants for college, and about 550 times as much as the federal government spends on national parks. For the last 8 years, most of the debate about health care has not been about this extraordinary fact that we may be spending up to half of what we spend on health care unnecessarily. Instead, we've been arguing about health insurance. In fact, really, we've been arguing about 6% of the health insurance market, the individual insurance market. The truth is, we'll never have lower cost health insurance until we have lower cost health care. So instead of continuing to argue over a small percentage of the insurance market, what we should be discussing is the high cost of health care that affects virtually every American. And here's something we ought to be able to agree on. We're spending too much on health care, and too much of what we spend is unnecessary. And the 5 hearings we held reminded us of something else we should be able to agree on. One major reason for the unnecessarily high cost of health care is that the health care system does not operate with the discipline and cost-saving benefits of a real market. Too many barriers to innovation drive up costs, and most Americans have no earthly idea of the true price of health care services they buy, which also drives up costs. Let me repeat that. One major reason for the unnecessarily high cost of health care is that the health care system does not operate with the discipline and the cost-saving benefits of a real market. Too many barriers to innovation drive up costs, and most Americans have no earthly idea of the price of the health care services they buy, so that also drives up costs. As a country, American families, American federal and state governments, and private companies, we spend $3.5 trillion on health care in 2017, according to CMS, almost as much as we spend on the entire federal government in 2017, according to the Congressional Budget Office. High health care costs impact everyone. First, the taxpayer. Because the federal government spends about 1/3 of all federal dollars on health care, according to the Congressional Budget Office, of the $3.98 trillion the government spent in 2017, $1.1 trillion of that was mandatory spending for Medicare, Medicaid, and other health care programs. This federal government runaway spending is the principal cause of the national debt. The cause of the national debt is not national defense, national parks, and the National Institutes of Health. The cause of the national debt is the runaway government spending on health care, which is squeezing the budget for national parks, national defense, and basic biomedical research. Healthcare costs also impact states, all of which have to balance their budgets. When I was governor of Tennessee a few years ago, Medicaid was about 8% of our state budget. That was in the 1980s. Today, it is 30% of Tennessee's state budget. That means states have less to spend on fixing roads, educating children, and granting and helping adults and high school graduates get better job skills. Second, healthcare spending adds to the cost of doing business in the United States. Warren Buffett has called the ballooning cost of healthcare a hungry tapeworm on the American economy. And third, and most important, the rising cost of health care is squeezing the budget of American families. According to the Gallup poll, 80% of registered voters before this midterm election rated health care as extremely or very important to their vote, a higher percentage than every other issue polled, including the economy, including immigration, including taxes. I would imagine that every senator has heard stories from their constituents about struggling to stretch paychecks to afford a prescription or to cover a surprise medical bill. Any one of us who's received a medical bill in the mail has wondered, what am I actually paying for? Here's a story I heard recently. Todd is a Knoxville father who recently took his son to an emergency room after a bicycle accident. Son was treated. Todd paid a $150 copay because the emergency room was, quote, in network for his health insurance, and they headed home. So Todd was surprised when he received a bill in the mail for $1,800 because even though the emergency room was in network, the doctor who treated his son was not. So Todd wrote his senator, me, trying to figure out why it's so hard to understand what health care prices really are. If I'm expected to be a conscientious consumer of my own health care needs, he wrote, I need a little help. The issue of surprise billing is a widely recognized problem. It was highlighted in a report from the White House on health care costs just this last Monday. We want Americans like Todd and his son to be able to access quality care that they can afford. So earlier this year, our Senate committee set out in a bipartisan way to see what we could find out about lowering health care costs. We held 5 hearings over 6 months. In June, at our first hearing, we set out to better understand how much health care actually costs in the U.S., to see if we could get some agreement on the numbers. At our second hearing in July, we heard from Dr. James, who told us that up to half of what we spend on health care is unnecessary. At our third hearing later in July, we looked at administrative tasks imposed by the federal government and how those burdens lead to doctors spending more time on paperwork, less time on treating patients, and all this also increases cost. In September, we looked at why, when you check reviews and prices before buying everything from a coffee maker to a car, the cost or the price of your health care has remained hidden in a black box. This is something even the federal government's top health care official knows personally. Health and Human Services Secretary Alex Azar recently told a story of how his doctor ordered him to have a routine echocardio test, a stress test. He was sent down the street and admitted to the hospital, where after a considerable effort on his part, he learned the test would cost him $3,500. So after using a website that compiled typical prices for medical care, Secretary Azar learned the same test would have cost just $550 in a doctor's office. Secretary Azar said consumers are so in the dark they often feel, quote, powerless. In an age where you can compare different prices and check a dozen reviews when you're buying a barbecue grill, You should be able to more easily understand what you're paying for health care. And last month, at our 5th hearing, we heard about steps the private sector is taking to disrupt the healthcare system and what kinds of federal barriers are preventing private companies from lowering costs. As we held our 5 hearings, 2 conclusions became clear. Number one, we spend more on health care than any other country, but we don't spend it well. Again, Dr. James told us that 30, maybe as much as 50% of all the money we spend on health care is unnecessary. That's really astonishing. It echoes what Dr. Ashish, a witness from our first hearing and director of the Harvard Global Health Institute, who said this, quote, "The popular belief has been that the reason we spend so much more on health care than other countries is that we just use too much health care. Well, it turns out," Dr. Ashish said, "that when you look at the data, we are not using more health care. Why is it that we're spending twice as much? There are 2 reasons," he said. One is administrative complexity, and second, every time we use health care in America, we pay a lot more for it than any other country in the world. That was Dr. Ashish from the Harvard Global Health Institute. While it would be convenient to have a moonshot to reduce health care costs, this will require people other than the federal government. First, the largest purchasers of health insurance, employers are really leading the way in this effort to reduce costs. For example, let's take International Paper, which is based in Memphis. It uses a service called Best Doctors. Employees can use it for a second opinion on health care. Best Doctors review an employee's records, and then they either affirm or reaffirm the treatment recommended by a doctor or recommend a different course, such as physical therapy. The use of this voluntary program saved International Paper over $500,000 in 2017 by preventing unnecessary treatment. Another way employers reduce health care costs is through wellness programs, which encourage employees to lead healthier lives. There is probably no greater consensus in healthcare than that wellness, lifestyle changes like eating healthier, stopping smoking, can prevent serious illness and reduce healthcare costs. It's hard to think of a better way to make a bigger impact on the health of millions of Americans than to connect that consensus about wellness, reducing health costs, to the health insurance that 181 million people get on the job. About 60% of us get our health insurance on the job. Second, states are taking an active role in the cost of health care. The state of Maine, in 2017, required health insurers to split the savings with a patient if the patient shops around and chooses a doctor that's less than the average price the insurer pays. And in Oregon, the state compiles data on insured residents and uses this information to run a tool that allows patients to compare the costs of procedures at different hospitals. And third, private companies are creating innovative tools to reduce healthcare costs. For example, Healthcare Bluebird, a Nashville company, and a witness at one of our hearings, is a tool that helps patients find the best price for the highest quality care in their area using their employer-sponsored insurance that, as I said, 60% of us have. This is useful to lower costs because, for example, the amount a patient pays for cataract surgery in Memphis can range from as little as $2,000 to more than $8,000. Fourth, hospitals, doctors, and other healthcare providers have the potential to make a large impact on the healthcare system, on the healthcare costs problem. On a smaller scale, one of our witnesses, Dr. Gross in Florida, runs a practice that's called Direct Primary Care Model. Dr. Gross charges a flat membership rate of $60 per patient in cash for adults under age 65, $25 for one child, and $10 for each additional child. His practice doesn't bill anything to an insurance company for direct primary care members, not to Obamacare, not to Medicaid, not to Medicare. In return for this membership fee, members receive an annual wellness exam, 25 office visits per year, including same-day appointments, and some in-office testing and chronic disease management without paying anything additional out of pocket. That gives patient a defined level of health care at a predictable price, and that price ranges about $1,000 to $1,200 a year. On a larger scale, HCA Healthcare, who also testified, has 178 hospitals and 119 freestanding surgery centers located in the United States and United Kingdom, is implementing new techniques to reduce the spread of MRSA, a drug-resistant bacterial infection that occurs in intensive care units. These new techniques have reduced cases of MRSA by 37% at HCA facilities and have been so effective that the World Health Organization and the Centers for Disease Control and Prevention have added them to best practices. According to HCA, this reduction in MRSA infections saves $170,000 for every 1,000 patients. Those savings are shared among the hospitals, insurers, and patients. And finally, information needs to be easily available so patients, consumers, can find out the price of their care and take an active role in choosing health care and planning for medical expenses whenever they can. There's also a role for the federal government to play. Federal government spends, as I said earlier, $1.1 trillion on Medicare, Medicaid, and other health care programs. That was in 2017. And about 1/3 of all health care spending in America is by the federal government. So how we spend those federal dollars will obviously make a big difference to the health care system. There may also be things Washington can do or is doing that increases health care costs or prevents private companies from taking steps to lower health care costs. I want to find out what concrete, specific steps the federal government can take to reduce unnecessary health care spending or at least stop making the program work. For example, after our committee heard about gag clauses that prohibit a pharmacist from telling a patient their prescription would be cheaper if they paid with cash instead of their insurance, Congress was able to act and ban those gag clauses earlier this year. In August, CMS is beginning to require hospitals to post the amount they charge for services online and to keep that information up to date. These are the types of specific recommendations I'm looking for. Now, I've had some success working with experts to ask them for recommendations in priority order and then turning those recommendations into legislation. In 2005, I stopped by a meeting. I was a member of the Budget Committee then, and I've become increasingly concerned about the rapid increase in the federal debt and how it was squeezing out some of the essential programs that make our country competitive. So I stopped by a meeting of the National Academy of Sciences on American competitiveness, and I said to them, most ideas fail in Washington, D.C. for lack of the idea. I believe that if you, the Academy, will give Congress 10 specific ideas in priority order to improve American competitiveness, I believe Congress will enact those ideas. The academies got busy immediately. They recruited Norm Augustine. They put together a task force. They produced a report called Rising Above the Gathering Storm. They came up with 20 ideas, not just 10. They were specific, such as doubling funding for basic science research, such as creating an energy agency modeled after the Department of Defense's highly successful DARPA agency that would invest in high-potential, high-impact energy technologies. We now call that agency ARPA-E. And Congress used most of those ideas and put together a bill we called America Competes. We passed it in 2007 and reauthorized it in 2010. It was introduced by the majority and the minority leader, and it had a large number of Republican and Democrat sponsors. So that's an example of what can happen when experts give us specific recommendations toward an important public goal and give it to us in a way that we can actually implement them. That's what I'm looking for in the letter that I'm sending today to experts at the American Enterprise Institute and the Brookings Institution. Specific recommendations, preferably in priority order, about what Congress and the President can do to reduce the staggering healthcare cost problem in America that our witnesses from the Academy of Medicine and all across the board tell us we're spending nearly half of everything we spend on healthcare is unnecessary. I also want input from other leading policy experts, including economists, doctors, nurses, patients, hospital administrators, state regulators, legislators, governors, employers, insurance, healthcare innovators. I'm asking for as many specific legislative, regulatory, or sub-regulatory solutions as possible in writing by March 1st, 2019. I'm especially interested in policies that bring to the healthcare system the discipline and lower cost benefits of a real functioning market. One way to do that is to remove barriers that discourage innovators from coming up with new ways to reduce healthcare costs. A second way is to make it easier for consumers of healthcare to know the true price of what they're buying. And I would welcome suggestions of how those policy ideas could be implemented, what law to amend, what regulation to change, and any potential downsides to the policy recommendations. I will share these recommendations with Senator Patty Murray, who's the ranking Democratic member of the Senate's Health Committee, and with all of the members of our committee. I will share the recommendations with Senator Grassley and Senator Wyden, who are expected to be the chairman and ranking member of the Finance Committee. Our Health Committee and the Finance Committee has shared jurisdiction over health care costs. Sometimes that gets in the way of solutions. There's no reason it should. We should all be able to work together in a bipartisan way to address this startling phenomenon that the experts tell us is true, that we're wasting, that we're spending nearly half the money we spend unnecessarily on health care. Now we need for the experts to tell us exactly what to do about it. The federal government's not going to lower the cost of health care overnight, but I believe there are steps that we could take to make a real difference to American families. That might be 2 or 3 big steps, or it might be a dozen smaller steps. But we shouldn't let this opportunity to make progress pass us by. Madam President, I ask consent to include in the record, following my remarks, letters I have written in a mailing today to experts at the American Enterprise Institute and the Brookings Institution, as well as other leading healthcare experts. I thank the President and I yield the floor.